And now I'll introduce our first session. We kick off the event with a conversation on rethinking the clinical day in the age of AI and welcome Dr. Nancy Cibotti, a practicing clinician who joined Heidi, a leader in ambient AI scribe, as their Chief Medical Information Officer in January. Moderating the conversation is Tom Foley, host of the AI Shift. Tom, Nancy, welcome to the event. I'm going to go on mute and I'm going to turn it over to you two.
Awesome. Thank you, Carol. Nancy, it's a great opportunity to speak to you. Very much looking forward to this conversation and hearing the audience feedback. For the audience, today we're going to be focusing on the most important and personal applications in AI, of AI in healthcare, specifically in the clinical encounter itself. What does AI actually look like in the real patient visit? Where is it helping? Where is it creating friction? And how are the clinicians reacting to tools in practice? Certainly, AI has been the buzz. You're pick a conference, and AI is top of the list, and there are AI coming at healthcare from all angles. But talking about it in context of what's happening inside the in-person visit is of great interest. So Nancy, tell us what are clinicians feeling the most important pressure today? Where is the pressure points today from your perspective?
First of all, thank you for having me. I'm a primary care physician. I will say in terms of the pressure points, it depends on who you are. Certainly we hear a lot about the time is need for documentation. So seeing patients, finishing up those notes, but all the stuff that happens in between visits. So writing letters, prior auths, billing and coding. There's a lot of things that clinicians need to do just to practice medicine and not necessarily things that they went to medical school for. So again, I think in the age of AI, we have a lot of opportunity to really alleviate some of that burden.
Relative to AI and how it's being applied in the in-office type visits, how are clinicians? What are they seeing? What's the immediate time? What do you see as the immediate time savings? How do you talk to them about your particular product and how it benefits them, and ultimately what benefits does it bring to them in the terms of usage?
Yeah, I think, Tom, it might be helpful just to frame sort of before AI and then after AI. And just to back up a little bit, so prior to joining Heidi, Heidi is a company that is a AI care platform that has several AI functions, and we'll talk a little bit about that. I was at Beth Israel Heidi Health, helping to deploy Heidi across our system, as well as implementing Epic, but that's a different talk.
Yeah, we won't go there.
We won't go there. I will say, so, prior to implementing AI as a PCP, I have a schedule of 20 patients. Before even seeing my first patient, I am gathering information. My last note, the specialist notes, the imaging study, the last mammography, the discharge summary, that takes time. So before I even step into the room, I'm sort of reviewing quickly, everything that's happened to that patient before, since the last time I saw them. And then I see the patient, and as I'm talking to the patient, I'm frantically typing on the computer, trying to take notes during the course of the visit, or looking up information that maybe I have missed. And then after the visit, usually at the end of the day, I am finishing up my notes. And as my family would tell me, typically on a Friday night, I wouldn't get home any sooner than 7 o'clock because I had all these notes to complete. And if I didn't complete them on Friday, I'd be spending my Saturday morning. And then, even after the visit, if I'm lucky, I will have my nurse or my medical assistant reach out to that patient and see if they're doing okay after the visit. Maybe I started a new medication. Are they tolerating it? Are they seeing benefits? What is their blood pressure? It's a blood pressure medicine. Or there might have been questions that came up during the visit that I didn't have the answer to. So I need to do a literature search and get back to that patient. So that's all pre-AI. And so now, what it looks like is that there are AI tools that can summarize, the information of the patient before I sit in the room. So they can take a 20-page discharge summary and give me a nice, neat paragraph about what happened to that patient during that hospitalization. It can pull in, the specialist notes and summarize that. I see the patient and I use an AI scribe. I put my computer aside, I face the patient, have eye contact, everything is captured, and the note is structured immediately in the way that I think. So again, by the end of the visit, I have a fairly complete note. And then after the visit, I can potentially use an agent to reach out to that patient to gather information. So again, there's a lot of changes that have happened in a short period of time that affects my ability to give care.
So when you talk about an agent after the visit, I didn't catch that in our earlier conversations, frankly, but is that an AI agent that reaches out and further engages and collects information that might not have been collected during the visit itself?
Yeah, exactly. Or more importantly, we decide to start a medication. That agent can reach out in 2 weeks. I switch them from amlodipine to lisinopril, and then in 2 weeks, I want to know what their blood pressure is. And so I can have somebody reach out to do that.
Is it a person or an AI?
I'm sorry, I can have an agent reach out to do that.
Yeah,
Yes,
exactly.
you can have a person do that too, but we don't have enough staff to do that for every patient.
So how does the patient feel about the use of the session being recorded, and what's the experience like from their perspective?
Yeah, I think that's a great question. For the most part, and I will say I've been using an AI scribe, an ambient scribe, for about 18 months. I have not had a patient say no to use it in the last year, because we do get consent. I'm in Massachusetts, we are two-party consent. And, so we start every session asking consent of that patient. And really, people understand that this is a valuable tool and have not said no to it. So the other thing that we're seeing is that patients, are seeing, their doctor is making eye contact. They're more engaged. And there's a few studies out there that suggest, we can even see or trend better Press Ganey scores for those physicians who are using an ambient scribe.
So does the platform in and of itself, it would seem like as you said, the physician's fingers are off the keyboard. They're no longer having to type, listen, and talk all at the same time. So I would imagine that, to your point, does improve the conversation, because you're eye to eye with the patient versus eye to keyboard and somewhat listening to what the patient's saying. So I get all that. So is it the value of you're still going to spend that average 12-minute engagement, but spend it more wisely and more around the value proposition, if you will, versus collecting the data as you would, because again, I'm typing, talking, and listening all at the same time. I'm just trying to get to what is the efficiency from the doctor's perspective in terms of that 12-minute encounter, that average 12-minute encounter?
I think the efficiency is gathering the information and making it look like or forming a note that makes sense for me. So, for example, I'm a primary care physician. I write different notes than a cardiologist or a pulmonologist, or I write a different note than the PCP down the hallway. And so I'm able to have a customized template that captures the information and organizes it in the way that I think. I think the other value proposition, and we hear about this a lot, is that there's just less cognitive load, and that term's been used. When I was at BILH, I went out to the practices that were using ambient AI, and a lot of physicians actually get their notes done no problem. They have templates, they have smart phrases. So it really wasn't about the time. It was, there's less cognitive load. I can really focus. It's just a more pleasant way to practice medicine.
Yeah.
I I was going to say, I will add one more thing. I also think the documentation is better. So when you look at, as a PCP, I may address 10 problems with you. But at the end of the day, when I'm trying to finish my note, I remember 9 of them and I forget that 10th one. But yet the AI won't do that. And if I forget that 10th one, it may not be important to me, but it's important to the patient. So suddenly Mrs. Joan is calling me 2 weeks later and says, my toe still hurts, and I didn't have that in my note. So, beyond sort of the cognitive load, the time savings, and the documentation itself is better.
Yeah. I come from a time when there wasn't EHRs were not prevalently deployed, right? So I come from that paper world from a health IT perspective, and have lived through the 3 phases of meaningful use up until today, and very involved in other aspects. So the doctors would say, to some degree, for those that haven't adopted your platform or a like platform, what this is just another technology, right? And there's kind of this resistance in that context. What would you say to that audience relative to why this should not be looked at as just another piece of technology?
Yeah, and that's a great point. And I know those folks, there are people out there who say, I'm miserable, everything's terrible, but please don't change it. And the reason is because they have sort of figured out, and practiced medicine in the same way for decades. So I think, again, this gets more into change management 101. You want to actually engage those folks early, hear their concerns, understand where they're coming from, but then give them a tool that makes an immediate difference. And what I love about, an ambient scribe, and especially, Heidi, which I've adopted, is that you can turn it on and go, and you see the value of it right away. There are so many things that we have tried to implement that had either fizzled out or added burden or didn't live up to their promises. And I do think, with a technology like this, people do feel the difference. It's an early win, and then you can really engage those folks. And honestly, they become your best champions when you're able to prove that to them.
Yeah, so AI in and of itself has some look at it as very valuable, right? Everybody's talking about it. But the one thing that comes out in a lot of the conversations is I don't trust it.
Yeah.
It's inaccurate.
Yeah.
So to me, that seems to be the first barrier. I did ask the question about technology, but maybe I should have asked the question about trust first, and then about the adoption of the technology. What do you say about the trust issue, and why it can be trusted and used fluently throughout the day?
Yeah, I think, again, you have to experience it. I will say one thing that new users are amazed at, and when they first use it, is the accuracy of the AI. It really does capture the whole conversation, and if it does it well, it really builds that trust. I will also say that, when you start getting away from, not getting away, but, there are other AI tools that we use, things such as clinical decision support. So, we know that a lot of physicians are using open evidence. Heidi also has an evidence tool. So you want to trust but verify. So when you use these tools, to have a citation that backs up whatever the recommendation is, and be able to link on that and say, aha, yeah, this comes from JAMA, this comes from New England Journal. I can dig into that, and that way I feel more comfortable with the recommendation. So the other thing, go ahead.
No, go ahead. You were going to finish.
I was going to say the other thing that I hear, and I know Medical Economics recently did a survey looking at, what do people think about AI, and surveying clinicians. And the other thing that comes out is privacy. There's concerns about privacy issues. And a lot of that, I won't say has been solved, but, working in health systems who have very high standards with regards to where does that information live, who has access to it, Can it be hacked? All these things are looked at when we deploy these tools. I will say that, we, for the most part, have seen, privacy concerns being addressed. It's a lot of the same encryption and tools that we use for our financial institutions to protect our money.
Interesting. All right. So there is, there's this crossing of the chasm. We went from, what is it pre-AI, now AI, using Heidi. We talked about the trust and the concerns about, should I use it? Let's cross the chasm. And now I'm using it, and now I can't let it go.
Mhm.
Right. So, and I think that's, I know from my own experience in AI, that's what I see from doctors all the time. It is not a tool. It is not a piece of technology. It really is a transformational approach to how we deliver healthcare. In 2009, we went from paper to e, and now, and that had all of its connotations. But now delivery of care using AI really changes the entire game. And to some degree, and I'm not criticizing any particular EHR because I think they all fall in the same bucket. But the issue is that how do I deliver care? How does my platform now deliver care much differently than what it did through all the meaningful use and even 2 years ago, 3 years ago, pre and post COVID? What are your thoughts about that? What are you hearing from your physicians, your advocates that says, you know what, this is a game changer. I don't know if I can go back.
Right. And I guess the question is that's a good thing. The fact that we have a tool that is so effective and has really alleviated some of the pain points, is something that, we should be, happy about it. I will say that, when, the brief times where Heidi is offline, which is usually just for minutes, we hear immediately from our clinicians because they feel like they can't live without it. But if you think of, EHRs, now we can't live without them. So it's something that I think we need to be thoughtful about how we deploy it and how it changes our workflows. Right now, we're sort of integrating AI into our current workflows, which is good, not being disruptive. But in the long run, I think how those workflows evolve will be vastly different from what we do now.
Back in 2017, another Healthcare Now radio host, Justin Barnes, and I were at HIMSS, and I made the statement that healthcare, we have to get our fingers off the keyboard. That's when I was with Lenovo Health, and getting fingers off the keyboard is meant to say there is. I was not predicting AI, by the way, just for clarity. But the point there is that it's an inhibitor. We can't be, the physician, to your point earlier, cannot be a typist, cannot be a listener, and cannot be a talker, and only have 12 minutes to do it. Right? That's really, I would classify that as bad healthcare. So the idea that AI is that thing, if you will, that not only enhances the experience in the encounter itself, but to your point, talk a little bit about what happens after the encounter when you talk about an agent, if you will, reaching out to the patient for follow-up.
Sure. So in a traditional system, healthcare in the US is very reactive. I see a patient once a year. Unless they reach out to me, I don't reach out to them because number one, I don't have the time, and I don't have the staff to be able to do that. But what if we had a world in which I see that patient and I'm doing regular checks in on that patient for whatever their healthcare goal is and gathering information, That could be their blood pressure, that could be their blood sugar. Traditionally we say, if you have diabetes, yes, we'll check your A1C and come back in 3 to 6 months and we'll check it again. But, with an agent, we can collect that information in between those visits. So, remote patient monitoring is something that, again, has been shown to be very useful for hypertension and CHF. But, still you need people to be able to gather that data and interpret that data. What if an AI could gather that data and interpret that data and hand it off to a clinician who can figure out what the best action is?
Yeah, you're speaking my language. On my program, I often talk about the average Medicare patient with 5 chronic conditions,
Mm-hmm.
and that is that through CMS data, 5 chronic conditions, they see 9 different doctors in a given
Yeah.
year. They're only in front of their doctors 15 hours in that year. The question on how we get the value and outcomes is not what happens in that 12-minute encounter, although we have to make that more efficient. But to your point, you're extending that reach of AI into what happens in the other 8,745 hours, because that's really where outcomes is going to be reached or achieved.
Agreed. Absolutely.
So I am told that there are questions in the queue. We have about 7 minutes left, and so let me ask the one question that I can see. I'll ask it to you. Which tools best fit for you to summarize the patient's history ahead of your next encounter with them?
So personally, I use Heidi. I can put a discharge summary into Heidi, and it can be in the PDF form, and can read it, or cut and paste, whatever works, and ask it to summarize it. I find that to be very useful. There are EHRs who also do summaries, whether it's Epic or I don't know about Athena, but there are other ways to do it. But I have found Heidi to be very valuable because I also can tailor what I want summarized.
Interesting. So I have 2 more questions for you. If we were to revisit this conversation in 2030, and remember,
Mhm.
2030 CMS is going to have everyone in a value-based contract.
So they say.
So they say. Let's be positive. What will feel completely normal in the clinical day that sounds out of kilter today?
So I think what we have barely scratched the surface is, what does a healthcare AI that is patient facing look like? And I know, there are various efforts out there to get healthcare information to patients, but I want to see AI empower our patients in a way that I think we don't do in our current system. So I'm thinking, as a primary care physician, my patient needs to wait to see me for their annual exam, to get their colonoscopy, order their mammogram, do their whatever. And it's an incredibly inefficient way to do things. And you also don't need, an MD necessarily to be able to do that. I see a world in which, my AI is going to remind me, gee, you're due for your colonoscopy. You have a family history of colon cancer. Schedule it for when I have, time on my schedule at the location that I want, and then, order the Uber to take me when that appointment's there. That's where I see AI going, is really, yes, it's really to put it into the hands of our healthcare teams, but put it into the hands of our patients in a way that makes sense.
I frankly couldn't agree more. I am a believer that by 2030 myself, that we will be in an autonomous care delivery model using AI. So that is a very powerful present. But I couldn't agree more in the context of the number one issue of how do we get the value is really about who can implement a patient engagement strategy that engages them in that 8,745 hours that ultimately is going to keep them on track or on the pathway to wellness relative to the plan that's had. We all know the stats. 30% at least of prescriptions never filled, or refills are not done. 30%, 10 to 30% of hospitalization is just based on medication compliance. Huge cost to the health system, right? So there's little things that we can do, little things to make a big difference. Medication compliance is one of them, and AI is a perfect tool for that. To your point of outreach, not only how do we use it in the office, but how do we use it outside the office to have that continuous delivery of care model that extends into the home, because home is really where wellness is achieved. It's not achieved in the office itself. At least that's my own personal opinion.
Absolutely.
So the last 3 minutes left. For the healthcare leaders and clinicians watching, what practical first steps should they be taking right now, to prepare for the next era of AI-enabled care delivery?
So I think health systems are moving away from these point of care sort of solutions, like one vendor that does this, another that does that. What we need is truly an AI platform that informs each other. So, gathering data before the visit will help me write the note for the visit. Will help, again, query a medical knowledge base, and then determine what is the outreach for the patient. So instead of thinking it as different functions, really look for solutions that cover the whole life cycle. And then, of course, adding the billing and the coding. There's so many things that can be done with one platform rather than multiple different platforms. And the beauty of that is they can all inform each other.
They can all inform each other. Yeah, I hear you. So in the interest of spending the last minute, what's on the roadmap for Heidi?
Oh, I don't know if I can tell you that.
Call you. That's the answer. Call
yes,
you.
Call me.
LinkedIn, email, call me. Send me a message in the chat, and we'll reach back out to you.
Let's say there's lots of stuff, but I can't reveal that.
Yeah, that's true. That's true. Dr. Cibotti, great talking to you. Very much appreciated. I think you're definitely a mover in changing the way in which care is delivered through the use of AI. So hats off to you for that, and best of luck with Heidi moving forward.
Thanks for having me.